Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Dr. Stephen Brownstein here, host of the Dynamic Radiologist Podcast, where I feature top leaders in health field and what they are doing to change the world. Past guests and organizations I've worked with include Rutgers, New Jersey Medical School, Newark Beth Israel Medical Center, and many more. I have Dr. Jeremy Weiss here, who has done thousands of interviews with successful leaders and health professionals. We have flipped the script, and he will be interviewing me.
Dr. Brownstein, I'm excited. And, I always think about this question. What is most commonly missed? What is most commonly misdiagnosed and not seen? And we're going to talk about that today. But before we do, I just want to tell people this episode is brought to you by two companies, Dynamic Medical Imaging, which Dr. Brownstein started over 16 years ago, and they help doctors all over New Jersey to refer their patients so that they basically have a board-certified diagnostic radiologist that's been doing this for over 40 years and his team. So you can check out dynamicmedicalimaging.com if you are a New Jersey doctor and you have patients. They even refer their family members to you guys. So they trust you that much. And also the Spinal Kinetics is also a sponsor, the spinalkinetics.com. And that's going to be kind of the focus of today, which is because medical providers of all specialties evaluate for the presence and severity of spinal ligament injuries. And so if you are a doctor and you do stress radiographs of any kind, they all send, you could be all over the country, they send their radiographs to you guys because you have a technology called CRMA, which helps evaluate the measurements and the exact abnormal motion problems in the spinal ligament. So you can check out the spinalkinetics.com if you're a doctor and you want to actually have them evaluate your radiographs. So, Dr. Brownstein, frequently misdiagnosis on imaging. And it happens also to be the leading cause of chronic pain. So what is the most frequently missed diagnosis?
Spinal ligament injuries, by far and away, most frequently missed diagnosis. And the problem is most of the time they're not even being assessed for. The MRI looks at 20 ligaments, which are the annular fibers of the disc. So there's 20 discs in the spine. But there's over 200 other ligaments that MRI really doesn't evaluate for routinely. And only with stress radiography, and we're measuring intersegmental motion abnormalities, meaning aberrant motion either front to back or top to bottom, and only by using a computerized program can we accurately measure the aberrant motion, the abnormal motion.
So I know you produced a white paper on this, and the white paper is on these topics. Talk about what do you explain in the white paper?
Well, in the white paper, we basically lay out the impact, the musculoskeletal burden of these injuries and what it's costing both individually, companies like work comp companies, the financial impact, and on a personal level, the amount of cost for medication and treatment is enormous. And again, since it's one of the leading causes of chronic pain, as we know, there's an epidemic of opioid abuse, and as a consequence, multiple deaths, unnecessary deaths as a consequence. So it's extremely important that we evaluate for these injuries. And again, the only way to do it is with stress radiography and with a computerized program, which we developed called CRMA, which stands for Computerized Radiographic Mensuration Analysis. And we have doctors refer cases all throughout the country, and we have board-certified radiologists licensed to practice in the state where the x-rays came from, evaluate and sign off on these reports.
Who's usually interested in this topic or reading the white paper?
Well, we have, I refer to this test as like a Swiss Army knife. because the results can be used by many doctors. You have the manipulative doctors, chiropractors, osteopaths, physical therapists. You have the return to play parameters with sports medicine. You have the pain management and regen medicine doctors. And you also have the surgeons. One of the criteria in order for them to be able to do fusion is they have to measure the aberrant motion. And if it isn't 3.5 millimeters of translation, for instance, in the cervical spine, they can't do the fusion. So it's one of the criteria that they have to meet in order to do fusion. So again, Swiss Army knife, it can be used from conservative care all the way to surgery. And
attorneys are interested in too?
Yeah, because doctor's job is twofold. One, to identify the full extent of disease and treat it, and also document it. So when the patient has maxed out as far as their medical care, maximum medical improvement, then the attorney, if it's a personal injury case, has to try to get a fair and just award and properly document, with proper documentation. The lawyer can present that document as his demand letter to the insurance companies to get a fair and just award for their client. And the spinal ligament injuries, in the AMA guides for permanent impairment, it's called alteration of motion segment integrity. If you have that, it carries a higher value as whole body impairment, or how much impairment your body has, than even 2 herniations. So it's extremely critical for the attorney to get this information from the doctors that are treating his clients in order to get a fair and just award for his clients.
Why do doctors, or why do they not do those type of radiographs? Like the motion stress radiographs.
Good question. We've been asking that for a long time. A lot has to do with probably about 14 years ago, chiropractors, a lot of them took x-ray out of their office because the governing bodies felt that chiropractors should have the same quality control as radiology machines in the hospital. And a lot of them had what called the wet processors. And it was just a pain in the rear end for them to maintain the quality, so they pulled it out. So what you have gets used. If they don't have x-ray, they don't use it as often. Or if they refer out, they'll refer out just for standard AP lateral and open mouth view, or AP lateral cone down view in the lumbar spine, and they won't do the additional stress radiographs. So that's part of it, and it's been our uphill struggle to educate both the doctors and the attorneys as to the importance of making the proper diagnosis, because again, this test helps to identify the presence, location, and severity of this abnormality, and based on the findings, we'll direct further care. And some doctors use what's called a Croft guideline based on severity. It tells the doctor, especially chiro, the frequency and duration of care, how many times per week for how many weeks they can treat the patient. And without knowing the severity, you can't classify them. So you kind of just winging it and treating everybody as basically the same, which everybody should be treated tailored to what they actually have. Yeah.
And I imagine, Dr. Brownstein, part of it is they don't have a technology to measure it as accurately. So they're not going to get the same data out of it that you would. How did you come up and develop the technology, the CRMA?
Well, the technology, back in 1970, Dr. Su from the University of Colorado developed the first, quote unquote, measurement tool to accurately measure intersegmental motion abnormalities. He was actually, it was first NIH grant, I think, that was issued to do this. And as computers got better, technology got better. So we actually did a study that we published where we took 100 x-ray cases, sent it to a board-certified radiologist to read. Those same 100 cases, we did CRMA, computerized radiographic mensuration analysis on it, at 27 ratable, meaning severe sprain findings. Radiologists found 0. So we were taught, you see what you look for what you know. But even myself, when I went back and reviewed these cases, and I know what to look for, 50% of the cases I would have missed because they're so subtle findings. How does your brain add movement front and back and combine it without having a computer to do it. It has to be a
Right.
specialized computer because you're measuring conversion points. And if you use a standard computer, that conversion point is off the screen. So you can't use the run-of-the-mill workstation software. You have to have specialized software developed that Dr. Cronk and I developed, the CRMA, and we're in the process of actually having an artificial intelligence program available to do this. So we've been on the cutting edge. The technology itself has been around for years, but as technology advanced, so did we as far as the programs.
Yeah. You even submitted the white paper to third-party payers, right?
Yes.
So what did they say?
Well, we're waiting for, the paper was just published about a month ago.
Got it.
Been sending out to basically work comp boards initially. That was the origin of why Dr. Cronk put it together, to make our procedure qualified to be reimbursed. But since then, we're actually using it when new doctors sign up for our service. We're including it in our so-called shock and awe package or welcome to the family package. We're sending it out to doctors that currently are using us as here's what we're up to. Here's how important how much importance it is to you and your patients, and to attorneys. So we're using it kind of multiple ways to get the word out. Dr. Cronk did an excellent job putting it together, and as soon as we get a box in here, we try to get them out and disperse that information.
Because the reason people aren't doing it, I imagine, is they don't know it exists. I imagine, right?
Well, it's not really talked about in any major textbook. I've participated in the two major chiropractic textbooks, radiology textbooks, Yoko Monroe and Mark Chiori, and they really don't pay much attention to this. It's kind of in passing, but it is critical to find out, how do you treat what you don't know you're treating? And there's even some chiropractors don't do x-rays anymore, which I find appalling and downright criminal as far as I'm concerned.
So, what's interesting is it is pretty groundbreaking, because if you are a patient or if you're a doctor and you're like, I know there's something wrong, but we just can't prove it scientifically sometimes, this is a way to actually have some, objective data.
That's correct. In fact, if you look at this test can be used in 3 different areas or a timeline of a patient gets injured. As part of the initial workup, physical exam, and then stress rate, radiographs and stress radiographs, and evaluate so the doctor can put together a treatment plan. 2, it can be used if the patient's plateaued and the doctor's saying what's going on, and or he does an MRI and the MRI findings don't correspond with the clinical or the physical exam. And 3rd, it can be done after the patient's reached maximum medical improvement, almost like a post-mortem, if you will. What's still wrong with me? And it can be used almost like a plaintiff IME to document the persistent full extent of disease.
Yeah.
A Swiss Army knife has multiple uses by multiple doctors, and within one doctor type can be used multiple times in the patient's timeline.
Yeah. I mean, exactly. And I want to know, how does it work to work with you? Because so let's say, there's a doctor in Idaho or California or wherever. How does it work from, okay, Dr. Brownstein, this sounds great. You've totally convinced me I should be doing the stress radiographs. And I send them my local, imaging center in Idaho. Of course, in New Jersey, they should send them to you. But what happens after that? How do they work with you in the company?
First, they have to raise their hand and show the interest. And then in New York and New Jersey, they call our number in New Jersey, 908-687-2552. And if not, then they can contact the main company, thespinalkinetics.com. And then we have a whole onboarding process. The girls out in our national company will walk them through the process. So once they know the process, we can accept images, X-ray, if people are still doing hard copy X-ray, disc, or point-to-point, where images are sent either from a doctor's DR, CR machine, X-ray machine, digital X-ray machine directly to us, or from the imaging center. We set up a direct line, point-to-point, where they can transmit the images from the imaging center to our central office.
So there's just a connection set up between them and you, getting you the images, and then from there you can use your technology and read them and get them the analysis?
Correct.
Got it. Yeah. Well, Dr. Brownstein, it's always great to hear this. It's always great to hear from you, because we've always been in those situations. Some people as patients and some as doctors are like, a patient comes in, I'm having excruciating pain. They take imaging, just normal imaging, static, and like, well, I don't see anything. But obviously the person's in excruciating pain. There's something wrong. There's something there. And from a patient perspective and from a doctor perspective, it's always good to know there is some actual objective findings that can be actually proven. So I don't know if there's any final words on that. And I want to just encourage people to go to thespinalkinetics.com to check out more. But any final words?
Well, the final word is, I love MRI. As a radiologist for the last, since 1984, I've been reading MRI. But it doesn't tell the whole picture. And, one of the things that we've started to do, I've actually started a new company called Integrated Radiology LLC, where if patients had an MRI and a CRMA, I do an integrated report where I look at each disc level and comment on, the MR findings and the CRMA findings and make a composite so the doctor or attorney can know the full extent at each segment of what's going on.
Yeah, what's interesting though, it's such a contrasting imaging, because MRI, if you move, it ruins the imaging. So, right?
Right.
Yeah, so the CRMA, you need the movement to actually make the analysis. So the combination, it seems to fit well.
Right, and I guess Einstein was a genius. He said, nothing happens till something moves.
There you go. Quoted by Einstein. Everyone check out thespinalkinetics.com. Check out other episodes of the podcast. And Dr. Brownstein, thanks for having me.
My pleasure.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.